Good morning all. Today we will be discussing describe theories of shock absorption of periodontal ligament. This question was asked for 15 marks. So we'll be writing the answer accordingly. Just because the question was asked in 15 marks, we will be writing the content. In the content we will be writing introduction, definition, composition, diagram, functions, and followed by the theories. Just because the theory part is very limited and we cannot leave the answer as such because it's been asked in 15 marks, so we will be writing definition, diagram, function and all the things in order to score good marks. Introduction, and moreover teacher wants you to write all the important thing associated with this answer. So in the introduction we will be writing the attachment temperatures of the tooth, that is two hard component and two soft component: periodontal ligament, cementum, alveolar bone and gingiva. Then we will be writing the definition of periodontal ligament. Periodontal ligament is a unique, multifunctional, soft, specialized connective tissue present between the root of teeth and the bone forming the socket wall. So periodontal ligament is a unique structure because it is bonded by tooth on one side and a bone on the other side. It is multifunctional. It serves so many functions, and just because it is made up of collagen, it is soft and specialized connective tissue. Synonyms: it is also known as periodontal membrane, alveolar dental ligament, desmodont, pericementum, dental periosteum, and gomphosis. Cells of PDL. Just because the PDL is made up of collagen fiber, the most abundant cell will be fibroblast, because fibroblast has a copyright of either formation of collagen or destruction of collagen or either repair of collagen. So whenever there is formation of collagen, fibroblast will be there, or either if we talk about repair, then also fibroblast will be involved, and if degradation of collagen will be there, then also fibroblast will be responsible for that. So that is why the most abundant cell is fibroblast. So in connective tissue we will be writing in synthetic cell fibroblast, as well as in resorptive cell we will be writing fibroblast. So first synthetic cell fibroblast, on the cementum side cementoblast, on the bone side osteoblast, and then resorptive cell again fibroblast, and then osteoclast, and then cementoblast. Epithelial rest cell, epithelial rest of molasses, undifferentiated mesenchymal cell, defense cell, macrophages, mast cell, eosinophil, neurovascular element. And then the answer will be followed by a neat and clean diagram in which all the periodontal ligament fibers should be marked. Then the function of periodontal ligament. The functions of periodontal ligament are supportive, sensory, nutritive, homeostatic and eruptive. Followed by the shock absorption. The proprioceptive nerve ending in the ligament form part of extremely refined neurological control of mastication and thus protect the ligament from damage. In addition, blood supply, the ground substance and collagen bundle all takes part in the absorption of functional stresses and their transmission to the bone. So it basically acts as a shock absorber. Then theories of shock absorption. Various theories are being proposed. First is tensional theory, next is viscoelastic theory, and the last is thixotropic theory. So first is tensional theory. In this theory we will be writing, when a force is applied to the tooth, the principal fiber first unfold. The collagen fiber, they will unfold and they will straighten and then transmit the force to the alveolar bone, causing elastic deformation of the bony socket. So in this theory the main importance is given that the fibers, they will unfold and straighten, and then which lead to the transmission of forces to the alveolar bone. And when the alveolar bone has reached its limit, the load is transmitted to the basal bone. Drawback of this theory is this theory has been found to be insufficient in explaining in experimental evidences. Next is viscoelastic theory. This theory describes the vascular ground substance complex as a shock absorbing system and the fiber bundle system as a suspensory system limiting tooth movement and transmitting strain to the supporting bone. So basically, this theory hold responsible for various vascular element that is present. They are basically, according to this theory, vascular ground substance are responsible for the shock absorption. And the displacement of tooth is largely controlled by the fluid movement, with fibers having only a secondary role. According to this theory, the collagen fiber, they are only serving the secondary role. The major role is by the vascular element. Thus, when a force is applied to the tooth, a series of events follows. Initial displacement of tooth is associated with intra and extravascular fluid movement from the PDL to the marrow space of the bone through the foramina in the cribriform plate. These foramina are more in the cervical third of the tooth than the middle and the apical third. After depletion of tissue fluid, the fiber bundle absorb the force, they slanks and tighten, and this lead to the blood vessel stenosis, and arterial back pressure cause ballooning of the vessel and the passage of the blood uh, ultra infiltrate into the tissue, thereby replenishing the tissue fluid. With further pressure, the alveolar process distort. If the load is sufficient, powerful and prolonged, the tooth substance itself, that is the dentine, will distort. Advantage: the viscoelastic theory has been better accepted by various researchers. They are all hypotheses. Thixotrophic theory. The thixotrophic theory describes the PDL to behave like a thixotrophic material, and the thixotrophic material is one which can undergo a gel sol or a gel salt transformation. This theory considers PDL to be a collagenous thixotrophic gel and that the fiber are only artifacts. This theory has not been accepted. So, with this is the complete answer of various theories of shock absorption of PDL.